So another very important concept I've found in explaining knee pain to patients, why it occurs, what the mechanisms are, and to really get them to understand the importance of the treatment and how it works, is I explain the difference between water consistency and oil consistency, a lubrication consistency within the knee joint itself. So I explained that when a knee inflames, there's a lot of water consistency. So inflammation is more thin fluid. It has irritants, chemical irritants in it that actually create pain. It irritates all the tissues. There may be blood. There may be more of a consistency of water in the knee joint, but generally in the knee, and that's why they get the water on the knee, that lots of doctors, family doctors, orthopedists will talk about somebody getting water on the knee. Well, knee is inflamed. Inside the knee, as we all know, there should be synovial fluid. There should be a lubricating force, like an oil. And if you have more inflammation than you have the oil, then you have a water consistency trying to lubricate the knee instead of the oil consisting of lubricating the knee. So I say to the patient, well, if I filled your car engine with water versus oil, what would you expect to happen to that engine? Well, almost every one of them knows that that engine would seize, that engine would be broken, that engine would not be lubricated, and it would get destroyed. So if your knee is inflamed over a long period of time, that knee is going to get more destroyed. That's going to be more wear and tear, less lubrication. So if we can laser the knee and decompress it, lasering it, flushing out all the inflammation, bringing in new circulation to try to heal up the damage, and also laser. Now, we haven't gone and proven this research-wise, but what I notice with a lot of patients is they get up off the table and they're like, wow, stand on my knee and it feels like it moves around, it slides better now, and there's not as much irritation, and it feels better supported. I thought, well, laser treats any cell. It increases the function of any cell. The cells on the inside of the joint capsule, there's the cells that create lubrication for the rest of the knee. What if there's potential that those cells stimulated by laser increase the secretion of lubrication? Now, as we know, with loss of lubrication, the knee dries up a little bit, just because those cells over time stop working as efficiently, but possibly laser could increase the secretion of lubrication, one mechanism. So if we explain to the patient that oil consistency, water consistency is inflammation, oil consistency is what should be there. Then when we separate the joint out, that lubrication that's the outsides of the joint has got squashed out and replaced by water on the knee or inflammation consistency, then if we can get more of that oil to the center of the joint in between those joint surfaces where they should be, then that will lubricate the joint better. So, in summary, car engine. I asked the patient, if I filled your engine with water versus oil, what do you think would happen? Answer's pretty simple. This is what's happening in your knee. You're getting water instead of oil. We need to increase the oil. We need to use laser to help increase the healing, reduce the irritation. We need to separate the knee surfaces so that lubrication can get between the surfaces where it needs to go. And even if I have an osteoarthritic knee, even if I have something that's very, very irritated, or a rusty hinge, for example, if I grease that up and oil that up and get it lubricated again and reduce some of the pressure in it, then I'm going to have a patient that feels a whole heck of a lot better and has a whole heck of a lot better function. So use that oil versus water in an engine analogy. Patients get it every time. Thanks so much for watching.